So what we need to know, first of all, is, at least in the United States, how bad off we are. And I just thought I would bring up this particular slide. Let's see if it works when I do this. And this is a comparison of how good we're doing. I'll enlarge it so you can see it a little bit better. So these are the countries and the populations. And you see, most of the developed countries have between 100 and 95% coverage.
The slide isn't showing.
We're not seeing the internet that you're linking to.
Okay, let me do this again.
Yeah.
You may
Usually,
have to open
if you,
it and then share it separate. There you go.
yeah.
Yeah, thank you. Okay, so you see that everybody has got 195%, Costa Rica 91, and then the United States has among the lowest, and they're saying 91%. This was less. This was 80% when I saw this slide a couple of days ago. I don't know what happened to it. It somehow improved. And meanwhile, the percentage of our gross national product is, we're spending 16%, which is way above everybody else. And our out-of-pocket expenditures are much higher than everybody. Our standard of living is such that, with few exceptions, we are the lowest on the totem pole for length of life, other than Hungary. And so the infant mortality rate is, well, a little bit above average. And so maternal mortality is a bit above average. So our healthcare delivery system has dramatically improved since Obamacare came into vogue. And I will describe that a little bit. Go to the next slide. Just a minute. And so here's a brief description of, with great pain, President Obama managed to get some kind of a national healthcare system. Now, there already was a national healthcare system. It's called Medicare, and it actually works very well. Doctors are paid a preset amount for certain procedures, and Medicare pays approximately 80% of what the costs of them are, not so much on the drugs. And of the last couple of years, there are what they call Medicare supplements that people are able to purchase, oftentimes using their Social Security payments and automatically paying into that system, so that the vast majority of their medical care is taken care of. And so this Obamacare has been a manifestation of the Affordable Care Act, also called the Health Care and Reconciliation Act. And of course, the Republicans have been trying to destroy it. But meanwhile, scores of millions of people are taking advantage of this subsidized health care. And it provides for all of these different services, ambulatory care, prescription drug benefits, and it, to some extent, it allows the government to negotiate for prices on various medications. And so they spend a certain amount, but it's far less than the amount that they would have to pay for regular private insurance. And what's true is that approximately 50% of the bankruptcies in the United States are caused by medical problems. And so it's a disaster. Getting sick is a disaster for many, many people. Any questions so far? Feel free to ask questions or make comments. I am an open field for discussion.
I going back to that first chart where it showed a relatively high number of people being covered in the United States. I think we should, well, I'm not sure where that number comes from. It seems a little bit high to me, but my guess is that it includes people who are grossly underinsured. In other words, they can get sick, they have insurance, but they still have every capacity or every high likelihood of facing bankruptcy if they get really sick, even with their insurance.
Agreed. Now, we have one example instance. Believe you're in Wisconsin, are you not, Maitita?
Minnesota.
Minnesota. So
yeah,
we have one example of what I consider to be a great system within the United States, and it's a cooperative. So let's pull that up. It's called the Group Health Cooperative in South Central Wisconsin. And the slide portion that I pulled up, what it is, it's a healthcare cooperative, and the funds are managed by the people. You know, they vote on a board and they enroll people, and they get womb to tomb health care, which is how we like to describe it when it's all the way done. And in addition to the usual allopathic treatments, and of course they use nurse practitioners and physician's assistants for a good portion of the healthcare, which really significantly decreases the cost. Not so much a whole lot. These guys make pretty good money, but it does decrease the cost, and it increases the population that can serve the sick people. But they have a track by which they have access to acupuncture and chiropractic and craniosacral infant massage, and all these different things are paid for within that cooperative. And so when you have a system that really cares about the people, you can actually generate a program that's worthwhile. Excuse me a second. Now, let's get into a little bit of what P.R. Sarkar said in his book, Human Society, Part 2. And he also gave instructions in Charya Part 2, about how doctors should function. So one of the things he said that in the Charya is that a physician whose patient dies should not take any fee for that visit. Well, when I'm with Medicare, I can't do that. It's considered fraud to not charge them, so I have to charge them. And he says the patient's convenience should be given more importance than the physician's convenience. That's true to some extent, although if you're really busy, you're just inconvenienced the whole time. And we have a nursing shortage in the United States, and it's common for the nurses not to have time to go to the bathroom or eat. And so that it decreases the quality of care, which goes into medical malpractice and errors, because nurses are often the ones who are actually monitoring the medications and giving them, even if the physician writes the right prescription. There are errors in delivering it. So now, granted, a lot of those errors become more lethal the older you are, because you're nearer to death and you're all on more medications. And it's a very well-known fact that the more medications you are, the more likely you're going to have bad side effects. And so the insurance companies and pharmacies have been cognizant of this, especially in light of a report from the Institute of Medicine about 10 years ago. It was the report was called "To Err is Human," and they talk about how many errors there were. And so a number of practices have come into vogue, including what's called a timeout. That means before you operate on somebody, everybody sits there and repeats their guru mantra, talk to the patient. Is this really the leg I'm supposed to operate on? And everybody just gathers around and marks the leg with the magic marker, etc. So that tends to avoid operating on the wrong patient, operating on the wrong part of the patient. And then there are more built-in streamlines. Having said that, you would think that computerizing medicine would make it better, but really it doesn't, as far as I can tell. The monitoring metrics for has everybody had their hemoglobin A1C, etc., it really just adds to the physician's workload to the point where 50% of doctors at this time are experiencing burnout. And a lot of people are quitting the practice because they can't handle the stress. And that's what the malpractice actions, regulatory actions, and just the hassle factor of dealing with private insurance companies who are trying to minimize the amount of money that they're spending. On the other hand, the insurance companies are mandating more preventive care. And so in that sense, the practice of medicine has improved somewhat because preventive care is cheaper than palliative care or cheaper than what you might say, repairing care. Am I clear so far? Okay, so let's go to another slide. So one of the things that Anandamurti, or P.R. Sarkar, was recommending is a triage system. And that means that when someone comes to a physician or a hospital or whatever, they got triaged and say, what is the best approach to taking care of their illness or preventing their illness? And so Anandamurti described several systems, including homeopathy, naturopathy, allopathy, and he also mentioned surgery. And he didn't mention acupuncture, Chinese medicine. There are other systems of medicine. And in India, Prime Minister Modi has promulgated this Ayush system of medicine. And really, it's all of the alternative systems that are initially based in India. So Ayush stands for Ayurveda, Yoga, Naturopathy, and they're lumped together, Unani, Siddha, and homeopathy. So Ayurveda, we've already described to some extent. Ayurveda uses yoga and timing of meals and timing of when you go to bed, as well as a bunch of different herbs for one thing or another, and some minor surgical procedures, especially they talk about doing specific treatments for hemorrhoids and anal fistulas. They have a specialty in that. Yoga, I think all of you know about, you're associated with Ananda Marga. That involves yoga practices of breathing and positions and spiritual practices of meditation, etc. Naturopathy is to some extent subsumed in Ayurveda. It focuses more on water healing and fasting and herbs. And of course, in the United States, approximately half of the states have licenses for naturopaths. And some places they're allowed to do minor surgery and even do home births. I taught some of that when I was in Portland, Oregon, about 30, 40 years ago. Unani is a system of more or less manipulation, pounding on things and manipulating the spine and the limbs. And homeopathy is the art and science of giving people a very tiny amount of a medicine, which, if it was given in large dose, would cause the illness. But in this tiny, tiny dose, it's to action and cures the same illness. And so the mantra they use, if you like, the slogan is similibus similumum curantur. And in some people will call a piece of the snake that bit you is going to cure you. And Anandamurti mentions that some of that was actually practiced at the time of Krishna, and he mentions that in the Mahabharata. And so Indian government actually has a department of Ayush, which promotes these. Of course, in places where they're very popular, the medical establishment tries to squelch them, saying that they're unscientific. And so what's true is that the number of medical doctors in India to treat everybody and the costs that they incur, the number of doctors is not enough, and the costs are a lot more expensive. Suffer in one way or another. They turn frequently to these other modalities and they get cured in one way or another. And even if they don't get cured, they don't have the risks of the side effects from the surgeries or the risks of the side effects from the allopathic medicines. And in truth, most allopathic medicines are described by my former mentor, Dr. Robert Alexander. May he rest in peace. He's a great physiologist. He says medicines are all poisons. They just preferentially poison one thing to try and make another thing better. So it's not common for most medications to actually promote health. Rather, they decrease some function in the body to allow some other function of the body to work better. So some areas, so in India, there are these competing practices, competing methods, which are to some extent in competition, and there are legal battles that are going on, especially in the state of Kerala and South India, which has a very strong alternative medicine program. And there are actual medical schools with thousands of doctors and probably physicians' assistants to some extent in all of these different systems. I actually spent a week teaching yoga at a Ayurvedic medical college in a town called Paikmal in Orissa. Initiated a few people. It was a very pleasant experience. And they grew their own herbs. So this is something about geographic aspects. And so in the Anandamarga system, which you're familiar with the name Anandamarga, the path of bliss, there are a number of clinics that have been established around the world. Certainly when I used to go to Haiti and Nicaragua, we would practice mostly allopathic medicine on an urgent basis and teach people yoga, asanas, and meditation and dietary approaches to help deal with their sufferings. In addition to that, some Amurt clinics, Amurt is the Anandamarga Universal Relief Team, have been established and are ongoing. So one of them, let's say, is here. And, wait, that's the wrong, sorry. So this is the clinic in Kashijaria. And there, and you see here, I believe this is Dr. Let's see if I can make him bigger. Dr. Dilip Prout. That's not working. Okay, let's go back. And he's an acupuncture specialist. And his wife is also an acupuncture specialist, as I recall. And they have put together a clinic, a rather large clinic in Kashijaria, which is about 45 minutes away from Anandanagar. It's near Bokaro Steel City. And they specialize in children with cerebral palsy and children who are considered disabled. They can't walk. A lot of times they can't talk. They can't feed themselves. And so using various mental and psychological approaches, plus physical therapy, plus acupuncture, plus herbal therapy, and engaging the parents in doing some of the physical therapy for the kids. A lot of these kids who are literally basket cases And basket case means you put the kid in a basket and you drag him around. They are actually brought to a relatively higher functional level and able to walk and talk. And so that's been dramatic. But they also do regular medical care. And so they have homeopathy, they have herbal medicine, they have acupuncture, and they also have an allopath. They don't particularly do minor surgery, but they do a lot of physical therapy. And so this is a true representation of what Anandamurti was recommending. They tend to be funded a little bit by donations from the people who are cared for, but also they get a lot of help from a local Rotary Club and from some international organizations. Another Anandamarga facility is the Abba Seva Sadan facility, and that is in Anandnagar itself. And this is one that I personally am part of the supervision for, and I fund them personally. And here's the building. It's an actual hospital. It's really quite beautiful. This is what they've done with the grounds. And people go into the front door and they are greeted, and they will be treated either typically by a homeopath or by an allopath. And the allopath is very competent. Now he's not a MBBS, as they say in India. He's not a really specialist or a fully trained doctor, but I have sat with him and saw him handle cases, and he does a damn good job, and he'll see 20, 30, 50 people in a day. And the homeopath is one of our dadas. And then across the street from that, which you don't see here, is an acupuncture clinic and herbal clinic. And so in this particular hospital, they have pathology. They can do blood counts and some cultures and send things off and do some blood chemistries as well and check for infections of one kind or another. And they also have an ambulance that when people are too sick, they can whisk them off. And it'll take about an hour to get to Bokaro, Steel City, but they'll get them there. There's also a closer hospital I forget the name of the town. They have operating room capacity, and every once in a while they manage to get eye doctors. They have eye doctors coming in on a regular basis doing minor procedures and dealing with eye care. They have a GYN specialist who comes in, and once in a while they do cataract procedures. So they have a full operating room, and sometimes people will come in and they need resuscitation based on dehydration, and so they can give IVs and they can give IV antibiotics. So it's a somewhat complete healthcare operation. Here's a picture of some of the operating equipment that they have when they need to use it. Also in Anandnagar, we have Dada Prachetananda. Hang on a second, excuse me. Whom I also support. And he does first aid and allopathic treatments for people on a walk-in basis every day. And then I'll see if I have a slide of him, I forget. And I don't think so. And then every week or every month, they have visiting doctors coming in. And the Dada Prachetananda, who is at the Amrit Bhavan near the Pandal, and also the Abba Seva Sadan people, they both have dental care. And Abba Seva Sadan has X-ray and can do plaster and can help immobilize bones. They don't set bones, but they immobilize them. So, so that's all I wanted to say about the global approach. In many countries, there is a nationalized healthcare system. In some places like Brussels, the healthcare system is partly nationalized, but also people have to pay some private insurance. And so it is common to have a two-tiered approach. India has a two-tiered approach. That means that anybody who's sick can go to their hospital and kind of get taken care of, but the care is not as good as if you pay a lot of money and get the private care. So, okay, I think that's all I want to say about that at this time.
Japa?
Yeah, I just want to mention first about along the lines of alternatives. As a Waldorf teacher in Detroit and here in Louisville, I was able to join a cooperative. It was just a local cooperative. Actually, in Detroit, the school paid a premium for me in this alternative health cooperative. And actually, I had to pay the first time I went. It was expensive, $20. But then after that, every visit was free. So there are, I don't know, maybe check out your local Waldorf schools, because a lot of times Waldorf schools, because they have there's a whole system of medicine out of anthroposophy. I don't know if you're familiar with that or not, Stephen, Dr. Landau, that incorporates these things in a similar way to how you explained. And usually Waldorf teachers seek this, and they usually have a cooperative. And a lot of times the Waldorf schools pay their health insurance to the cooperative. In Detroit, there was a really, I think it's still thriving alternative care cooperative. And even in Louisville, we had a benefactor who established a health clinic and brought a doctor here who was both allopathic and naturopathic. So I'm just saying that a lot of times around anthroposophy or Waldorf schools, you'll find people looking for these kind of alternatives or making these kind of alternatives. I also want to mention in terms of things that Margies can do or Prouters can do in general. My wife actually ran an alternative clinic for the underemployed, and actually it was her ministry actually when she got out of divinity school, because she's a licensed massage therapist and zero balancing technician, and she gathered her other practitioners in Louisville, and they together opened a pop-up clinic for the houseless. They would go to a church and they would advertise it, and people could come in and get the benefit of acupuncture, massage. I think they did a couple of other alternative practices. So, people who are doing this work, massage therapists and whatnot, can, just as my wife did, organize practitioners to provide some alternative resources for people who normally wouldn't have access to them.
Yes, actually, Japa raises a good point. If you have a reasonably sized group, then you can self-insure. You can create your own insurance company. What is an insurance company besides a way of averaging out the risk? And so that's all that they are. And so you can contract with various doctors, or you can create your own system. It's work, can be done. Thank you all so much. Be active. And as Arnold Schwarzenegger said, be useful.
Indeed.